years to 5.5 years. I don't think I need to expand on this, the very intensive training that all of you have to undergo during those 5.5 years. Yeah. So some of the medical schools in Sri Lanka. Okay. And since due to the high competition, there are some students who are not able to enter the Sri Lankan medical schools. They might opt for overseas medical education. Considerations like the educational capacity, the capacity to complete a medical course, and the quality of the university is very much important, and whether it's recognized by the medical council, and the language, and there may be cultural issues. There are so many considerations, and now the economic consideration as well, if someone is opting for overseas medical education. And then the medical council approval, and whether it is accredited or recognized by the medical council. Okay. And the license to practice, any doctor to be able to practice medicine in Sri Lanka, they must register with the Sri Lanka Medical Council. That's SLMC. Without that, they cannot practice medicine. So they can be either graduates from Sri Lankan state medical schools or from overseas medical schools. And the medical council is a statutory body or legal body. The main objective is actually to protect the healthcare seekers. So it's not a trade union. It's not a professional body. It's a legal body, because the main objective is to protect the patients. Thereby, the medical council is interested about maintaining the quality and standards in medical education and the quality and standards of the medical graduates. The registration has 2 steps. First, the provisional registration to commence the internship, then the full registration following the completion of the internship. So those are the 2 steps. Once you are fully registered, then you can practice anywhere in the country. What are the prerequisites? So the basic degree has to be completed, and then for the Sri Lankan graduates, the state medical schools, common exit examination. You have to sit for the common exit examination. And generally, it's part of the final examination, what we call the final MBBS, or sometimes the end of clinical science stream. So the common exit examination is part of the final examination. For the overseas medical graduates, there is a licensing examination. And thereafter, successful completion of the internship. 1-year internship with 2 appointments, it has to be successfully completed. So those are the prerequisites for the medical council full registration. Common exit examination, which you will be facing, okay, we call it common merit examination also. And this again very competitive, because allocation of places for internship. The internship is allocated only in the teaching hospitals where the supervisory capacity is there. And currently it's done by ranking all the medical graduates. The ranking by all the medical graduates graduating into a single intake, from a single year of entry into a common merit list. That is how it happens. And this common merit list is also considered later in deciding the seniority in the appointments in the Ministry of Health. So it's an important component. It's an important stage in the careers of Sri Lankan doctors. This common exit examination or the common merit examination has 2 main components: the MCQ paper and the clinical examination. The MCQ paper and the clinical examination. The marks from the clinical examination are standardized, and both marks are amalgamated using the complex formula, and common merit list is prepared. It is prepared by the University Grant Commission. Once the common merit list is out, it is sent to the Ministry of Health, and Ministry of Health will be calling for the internship appointments. Then the prospectus interns can apply for internship. And generally, the graduates from overseas medical schools, they are put after the state medical graduates in a common merit list. Okay. So formulation, and there's a rank in order, and graduates who are in top of the list, they can select internship in hospital of their choice. For example, if someone is in the top part of the merit list, and if they want to get an appointment in the National Hospital of Sri Lanka, it's possible if they are in the top part of the merit list. So it depends on where you are in the merit list, and it is determined by the ranking. And ranking is according to the marks of the common MCQ paper, which is held twice a year, and also the clinical examination, and marks are standardized in the clinical examination. Overseas medical graduates, they must pass a licensing examination. That's called ERPM, the examination for registration to practice medicine. Okay, so they should possess MBBS or equivalent degree from a medical school recognized by the medical council. Once they pass this exam, they can apply for the provisional registration. So what's the current situation? Approximately about 40,000 doctors are registered with SLMC, and the actual number may be slightly low. I'm just giving the approximate numbers. And approximately about 30,000 doctors are working in Sri Lanka. And Ministry of Health is the main employer. Here, this has to be corrected as SLMC, Sri Lanka Medical Council. Okay. What's the current situation? If you take the approximate 40,000 doctors, in the ministry, majority works in the ministry in different capacities. Some of them can be medical officers, and some of them can be consultants. Some work in the curative sector, some work in the preventive sector. So the Ministry of Health is the main employee. University sector, currently about close upon 1,000 work as lecturers and up to professors in the university sector, in the medical faculties. Private sector, the full-time amount, approximately 4,500, but there are a lot of doctors who work part-time in the private sector. For example, many doctors, about 60% of the doctors who work in the Ministry of Health, they do private practice in the outside working hours, maybe in their own clinics or maybe in locums as private hospitals. Some join defense services and some migrate. The approximate numbers are not known exactly. We can assume based on the previous forecast or the percentages, we can assume maybe around 6,000, but the numbers could be more. So these are the kind of traditional career opportunities, either medical officer or specialist, or it can be a university career, some for full-time general practice, some may join defense forces, some may opt NGOs, like maybe Sarvodaya and different other NGOs, or INGOs like WHO, and some might opt for migration. So there are different career opportunities. It's possible that some may be taking careers that are totally outside medicine as well. That possibility is also there, but the numbers may be very low. Okay. This flow chart. So once passing A levels, if you obtain the Z score to enter Sri Lankan medical school, get the medical qualification. Okay. If the Z score is not adequate, some might opt for studying medicine overseas, and some might join the defense university, and then after qualifying, maybe armed forces. Okay, so what's the general pathway? Majority is the majority pathway, medical qualification. Due to the delays in starting internship, now there is a pre-intern period about 1 year, where some of you may be working demonstrators in faculties, and some of may be working in different other settings. During this time period, actually you are not permitted to get involved in clinical work or the patient care. Legally, it is not permitted. So that's the current situation. This period varies, maybe around 1 year. There are advantages and disadvantages during this time period. The advantage may be having some free period after a very hectic, almost 6 years time period, and maybe your personal requirements like maybe getting married, so on and so forth, or getting some valuable working experience, getting some research out, getting some income. So those are the possibilities. The disadvantage could be delays in your proper career pathway. So there are both advantages and disadvantages, but this was kind of interim measure or makeshift measure. In the past, there were situations where the graduates started internship as soon as they got the results. During the time period, there was only one medical school. That was the situation. But now there's a delay up to 1 year or even little more. Okay. So overseas, they have to do ERPM exam and then the common merit list. Okay, common merit list, and then 1 year's internship. The 1 year internship, there are 2 appointments, generally one medical type and one surgical type. So medical type may be medicine or pediatrics. The surgical type may be surgery or general ops, and sometimes maybe pediatric surgery. Okay, so the medical internship for 1 year. Then most would opt to be absorbed as medical officers in the Ministry of Health. There may be some time period after internship also. Currently, it's called the RHO period. Again, maybe about 1 year. During this time period, some gain experience in working different work settings or different wards. The wards that they might not have worked during the internship. But generally, this time period is considered as rather relaxing. The situation changed during COVID because RHOs were called upon for COVID duties. Okay. So the medical internship and then joining the medical officer as Ministry of Health. Joining the medical officer as Ministry of Health. Some might join the private sector. Okay, some might join the private sector and then different pathway. And some after internship, after getting the full qualification, they might leave the state sector completely and start their own general practice. This is a minority. Okay, and they can obtain their qualifications like MCGP. And some after internship, they might opt for a university career, and after medical officer also sometimes they might, when the career positions are advertised, they might basically opt for a lecturer position in a university. The traditional pathway, again the medical officer, they can select their PG programs. Some might not opt for PG program and they might remain as a medical officer and later senior house officer and a MO till their retirement. But nowadays, many would opt for career development. So it depends on the career pathway that they are selecting. Some, they can directly join the MD training program by doing the Part 1 examination, which is again rather competitive, and then starting as a registrar. The examples are the training programs in clinical medicine, surgery, so many clinical training programs. And after completing the Part 1, there's a Part 2 examination, again very competitive and also rather difficult, tough examination. But once you get through, then it's a senior registrar position. And after 1 year senior registrar training, then overseas training is mandatory for most of the PGIM clinical programs, because with only once the overseas training is completed, they will be eligible for board certification. Once the board certified, they are basically certified as consultants, and then they can be registered in the medical council as in the consultant category. University, some might opt for research degrees, especially those from non-clinical departments. From clinical and maybe paraclinical department, they might opt for the PGIM pathway. Some pathways have the diploma first and the MSc, then the MD. Those pathways may be slightly longer. Research degrees, MPhil and PhD. After that, they'll be eligible for senior lecturer promotion, after that professorship. Okay. So these are the pathways that are available, okay, from different career pathways. Armed forces, they follow the promotional pathway in the security forces. Okay, so general practitioners, very limited number. At the moment, I suppose around 600 to 1,000 are in full-time career as general practitioners, and many are involved in dual practice, approximately 6% who are employed in government. And for the academic progress, there's a College of General Practitioners. They have the MCGP examination, which gives the qualification recognized by the Medical Council, or internationally there's MRCGP examination, which gives an international qualification as general practitioners. So they can develop their careers while working independently using these options. Universities can join as probation lecturers after completion of the internship, or else they can join as senior lecturer probationary after completion of the postgraduate. And associate professor pathway is also available either directly or after completion of postgraduate. So it's a pathway. It can be either from probationary, senior lecturer, and professor. Sometimes some join in between. And that's also quite a laborious process. There is a very strict marking scheme where the promotion is based on the number of publication, the contribution to teaching and academic development, research work, dissemination of knowledge, contribution to the university and the national work that is done. So there's a minimum mark expected for the merit promotion. That is the based on the marks, and associate professor is lower than that, and the minimum of 70 marks. So based on that, there is a strict procedure with several interviews headed by different academic leaders, and then the professorship is awarded. Some join the defense forces. The promotion scheme is as a member of defense services. For example, if someone joins army, the starting point may be like a captain. And in Navy, sometimes they might go up to say like in a midway, what we call Sergeant Commodore, and beyond that maybe up to Rear Admiral level. Okay, yeah, in armed forces, generally the highest level that they can go maybe up to Major General, but very rare because the positions are very limited. So after long service, generally most of the doctors who join end up as brigadiers. And for the career progress, there is a College of Military Medicine, and there is PGIM course in military medicine, as well as the KDU, the academic pathways. And some opt to migrate, and in the current situation also that's possible. Generally, the migration rate among specialists around 13%. That may be a little more now, because sometimes when they go for the overseas training, some opt not to come back, and they have to basically pay a bond, and there's some percentage who stay overseas once they leave for the overseas training. Yeah, so that possibility is also there. And the countries that Sri Lankan doctors select for migration is generally those who go for foreign training. Sometimes they might stay at UK or in Australia. In addition, some doctors go for Middle Eastern countries, mainly like Oman, mainly to earn money because there's not much of a career pathway. In Australia, they used to take doctors for working in rural areas to start working as general practitioners and sometimes emergency medicine. And some doctors go to countries like Singapore. Previously, the Colombo degree was directly recognized by Singapore, but it is not there anymore. But now they may be taking doctors due to the COVID situation. So there are a few common countries that Sri Lankan doctors visit. Okay? And there are new specialties. Now, the traditional specialties are like more clinical specialties. Then you can like surgery, medicine, or the related subspecialties like ENT, ophthalmology, dermatology, so on and so forth. Or in the preventive path, it could be the MD and MSc in community medicine. But now there are new fields also, like for those who are interested in IT, there's medical informatics, and there are cadre positions in the ministry, the medical administration, and medical immunology, the medical education, family medicine. All these areas, there are MD programs, and sometimes you can opt for MSCs or even PhDs and then move forward in these pathways. So there are a lot of options available there also. However, the learning is continuous for a doctor. So school, higher education and postgraduate education, the continuous professional development is very important for medical doctor because due to many reasons. The explosion of information, medical education is changing, healthcare practices ever changing. Now the COVID situation has changed a lot and the expectation of the patients. So due to all these, we have to keep ourselves updated right throughout because the knowledge is changing so fast. When you graduate, you will be surprised how the knowledge can be outdated, how soon the knowledge can be outdated. So CPD is very important because in the past it was considered once you are in, once you have the MBBS, you are good for life, but not anymore. The expectations are changing because what research has shown is towards the final year, your performance is the best or towards postgraduate. But as time goes on, the performance goes down. Okay. Sometimes people might say, I have 20 years experience as a doctor. But if those 20 years, if you haven't reflected upon your work, if all you have done is in the OPD, write and repeat all, there is no development. It is going down. And at the same time, the expected standards are going up. Therefore, you can't remain at the acceptable standard unless you develop yourself. That is where the CPD comes into play. It is not only knowledge, but you have to maintain your skills and competence. For example, now you have to train on CPR, but very soon the de-skilling happens. If you don't do a procedure for some time, the de-skilling occurs. Competency goes down. Okay? So it's not only knowledge, but skills and competency and professionalism, all these areas. So CPD include not only clinical skill, but teamwork, communication, ethics and professionalism, research, very important, teaching, administration. All these competencies are very important in CPD. And ultimately, they should convert, the benefit should be converted to the patients, because if you develop your knowledge, if you develop your skills, the patients are stand to benefit, and that is what is most important. Okay. And a lot of work has happened due to regarding CPD. SLMA, the Medical Association, has started way back in 2020. Now the CPD portfolio system, all these are in practice and in the system, and a lot of initiatives by the colleges. Now we are planning to move towards online CPD with the use of online portfolio. So when you become graduates, this system will be definitely available for all of you. Okay. And a lot of colleges, associations conduct CPD activities, and nowadays a lot of emphasis on the online CPD. Because of the COVID-19 situation, a lot of activities are conducted online, and it offers several advantages: reduced travel time, flexible schedule, can access from anywhere. Okay. So online CPD would be the future. Yeah. So there are certain areas that we have to put our attention into. For example, the common exit exams, and it's a ranking exam, certifying exam, and licensing at the same time. So it is not really appropriate because in one exam you are trying to do many things, and issues related to the reliability and the formula. MCQ marks are taken as raw marks, and the clinical examinations can be variable. So those things can be, so the common merit examination, there are areas for improvement, because we need to improve the validity and the reliability of the exam, because then you will be fairly ranked. And again, the number of new registrations are rapidly going up, about 1,500. And with opening of new medical schools and overseas graduates returning, these numbers will be increased. And if the Ministry of Health to continue to absorb this workforce, then their card has to be expanded every year at least by 1,500. So the current economic situation, this may be challenging. So this may be something that you have to keep in mind in the future. Sometimes it might not be automatic to get the Ministry of Health employment straight away. So you have to think of other possibilities, other career options also. So we hope and we wish that for the current batches this will be available. So this is one one challenge that is available. And when you take the whole country, there's the issue of maldistribution. Because all of us, everyone want to come to Colombo. So the doctor population rate is high. But if you take areas like Monragal and Norelia, the distribution is very low. At the same time, doctors also, sometimes they are not willing to go into rural areas due to multiple reasons like social, education, so on and so forth. So these are issues that need to be addressed, because if the doctors are to go to rural areas, they need to be given facilities. At the moment in the PGIM, there is 1 year compulsory post-intern period before you start your PG training. So this is also to ensure that the service is provided for the country before you move into the postgraduate training. Okay? So there are a lot of areas for improvement. Another thing is regarding accreditation of medical degrees. Now there is World Federation of Medical Education. They have decided that from 2023, if a medical school is not accredited under the World Federation of Medical Education, then those graduates might not be able to get their registration in overseas countries. So this also might have some implications, not only about migration, but also about getting postgraduate training placements. So currently Medical Council is working on that and establishing an accreditation system for the medical schools in the country. So hopefully that would be in place. It is unlikely to affect you, but in the future, the accreditation of medical degrees will also come into play. So there are a lot of opportunities available. There are a lot of challenges. All these are your seniors who are now they are in their career pathways, different career pathways. So different possibilities are there. So my advice in conclusion is think carefully, plan carefully, depending on all these different possibilities and challenges and opportunities. And sometimes even going out of the way and selecting a different opportunity might pay dividends. Okay? Rather than just trying to go for what is traditional. But most important thing is identify what you like most. Identify where you can contribute most according to your competencies. Okay? And your characteristics, your personality. What are the areas that you some like to go for surgery, some like to go for more clinical work, and some like to take leadership, and some want to teach, and some like to do more preventive public health work. So find out, and some like IT, some like administration. So find out what you like most and focus on. Most important is not where the most money is, okay, but where you like. What you enjoy, you will do best. Okay. So with that, we conclude the session. Now it's open for discussion.
Thank you very much, sir, for that very interesting session. I hope all of us were
Okay, there are two questions. I'll from the chat. I'll answer those. One is, if one opts to enter the private sector after internship, some do as a medical officer. So I think what you mean is medical officer in a private hospital. Will that make him completely exempted from the state? Medical officer. So I think what you. Okay, yeah, there's some echo. Yes, all right. So. Yeah, it's possible. Some opt for this path, moving away from the not joining the state sector, but joining maybe a private hospital due to maybe some might not want to go to far away areas, so they might join, would like to join the private sector. So there are advantages and disadvantages. One disadvantage may be the job security. It depends on the private hospital that you are joining, or if you are starting your own practice, again it depends on how you will develop your practice. Okay, will that make him completely exempted from the state service? Answer is no. They can rejoin, depending there are vacancies, they can rejoin. However, they might be put their seniority may be affected. If they rejoin, their seniority may be affected. But other than that, they can rejoin. Other possibilities, can they do postgraduate PGM exam? They can do as private candidates. So that means there is a payment involved. Okay. Is there a course fee for the postgraduate training? There is a course fee. There is a course fee. However, for the Ministry of Health candidates, that course fee is paid by the ministry. Private candidates, they have to pay. So that is how it works. Okay? Yeah. And some countries, they don't have MBBS, they directly do the MD. Okay, yeah, it happens in both ways. Now, if you take the former Russian Federation countries, they have been given MD as the basic qualification. So they give MD as the basic qualification. It's not a postgraduate. Now most of the Eastern Bloc countries, they give MBBS, but some countries still continue to give MD, but it's a basic qualification. But in Northern American countries, they give MD. That is basically graduate entry. That's graduate entry. So they need to complete a primary degree, okay, like a BSc, and then only they can join the medical school. So those are graduate entry medical schools which are found in Northern American countries where the MD is taken. Okay. But in Sri Lanka, to be considered as a specialist, you have to go to the PGIM pathway and most importantly get post-board registration. What countries accept the Sri Lankan MBBS degree? Okay, do we have to sit for examination? Okay, yeah. In the past, UK gave the direct acceptance of the Sri Lankan MBBS. Not anymore. When the country was in the common, before 1970s, the direct recognition for MBBS was there for very long, but now it is not there anymore. But the MBBS and the postgraduate qualifications are recognized in those countries for the postgraduate training. And if you want to practice in these countries, then you have to sit for the exams like FLAB examination. And if you're in the United States, there's a USMLE and Australia also. So that is what you call the licensing exam. You have to sit the licensing exam. They need to sit the licensing exam and then start practice. Okay. Can we select any subspecialty without depending on the final? No, it doesn't depend on the final MBBS marks. It depends on your performance in the selection exam for that particular postgraduate. Which specialist is in demand right now? Okay, that varies. I mean, it depends on what you want, really. I mean, for example, now clinical specialties are anyway in demand and there's a lot of competition, and like clinical medicine, clinical surgery. However, the places are gradually filling up. For example, there's if you take up the conventional pathway like clinical and medicine or surgery, yeah. So initially, basically, you may be posted as a consultant in a rural area. It will be some time till you come to Colombo. So that possibility is also there. And some specialties, it may be in demand because of the private practice areas like maybe cardiology. And some specialties, even though there's a lot of private practice, or maybe orthopedic surgery. Some areas, even though there's not a lot of private practice, there is a lot of practice, but still because of the workload, they may not be very popular. For example, neurosurgery. So it varies. But again, don't worry about these things. Because my advice is do what you like. Is there a penalty for doctors join private sector or migrate? If you are funded by PGIM for the overseas training and if you decide to stay, then there is a penalty. Anyway, there is a bond that you have to sign before moving for overseas training. But others, there is no kind of penalty. So that is something that's not considered at the moment, but maybe in the future, it may be. Yeah. During the foreign training of the senior registrar, the salary is paid by the given country, not by the PGI, by the Ministry of Health. The salary is paid by the Ministry of Health or the employee, not by the country, because foreign training, the country, it's for the training facility. But sometimes some get employment during their training period. Getting a higher rank in common merit it's important, but it won't determine your whole future. It's important to get a good place for internship, a selected place for internship. Okay. What's the difference between MRCP and FRCS? Okay. FRCP. Okay. All right. Yeah. MRCP is by examination. By examination, there is examination. There is a multiple choice component and there is a clinical component. And after passing, the MRCP is given. Now, MRCP examination take place in Hong Kong also and Sri Lanka also. I think there are plans to have the exams. Yeah, so after completion, so once the MRCP, the membership of the college is given, and that's considered as a qualification. After some years, after completion of MRCP, then FRCP is given, the fellowship of the college is given. Yeah. Is there a field after MBBS for graduates who is good at technical, like computers, 3D modeling, animation? Of course, yes, that is where the medical informatics, the MD, there is a MSc in medical informatics, and there is a PGIM MD training, and there are consultants in medical informatics also. Countries like Japan and South Korea gives direct acceptance Sri Lankan medical undergraduates. As far as I know, no. How the salary increments are decided for the doctors? Okay, yeah, that's the salary pathway. There are different grades like SL1, SL2. The salary pathways are there. I think the medical doctors' salary level is SL2. Yeah, but that is quite complicated. The salary increments are according to the place they are employed. So if you are employed in the university, then there's a different salary pathway. But that is equated with the Ministry of Health doctors, with the equalization allowance, because generally university lecturers get lesser salary, but there is an equalization allowance. Generally, the government doctors get a higher salary, and there is a OT also. Because of the OT, the take-home salary is higher than the basic salary. Basic salary is not very high, but the take home is very high due to OT. Those are not ideal circumstances. There are the academic allowances. These allowances are also there. But I think the best pathway is for the doctors to get a salary level, the basic salary level that has to be in line with their work and the education. So those are basically still under discussions. Yes. Yeah. What's the future prospect after becoming a specialist? So once you become a specialist, you can get registered and you can be appointed as a consultant in a hospital, and at the same time can work in the private sector during after hours also as a consultant. And then, yeah, so generally the career progress stops at that level at the government sector as a specialist or as a senior consultant. Then it depends on the placement that you get, and some stations are end stations, like there are some stations in Colombo which are end stations, so that's closer to retirement. Yeah. Some specialties require no. I mean, it all depends on how you face your selection examination at the PGIM. Yeah. Okay. Any point of marrying before doing internship? Up to you. Okay. So it depends on again the different requirements. Yeah. Sometimes if there's a married couple, if both of you want to get the internship in the same place, then it depends on, we can apply, but then what is given is the lower position. So whatever the lower position, that is the common place that is given, but that is based on application. You can get the same place for internship. Yeah. There is a fixed number of attempts in postgraduate exams. Yes, I mean, some postgraduate programs, there is a fixed number and the number of times that you can try, and after that, you have to leave that program. Yeah. If a student is conducting research, what's the best career path? So there are different ways. One may be joining university, but then you have to be interested in teaching also. And then there are certain research degrees where you can select. Or sometimes the subjects like MD in community medicine, the research component is anyway incorporated. So those could be pathways. And yeah, so one could be moving away from PGIM pathway and doing the MPhil and research in the university, depending on your interest areas. After that, you will have to basically secure your career pathway. Are you joining a UN agency, or maybe a government organization. So that you have to decide. Yeah. Yes. Is working in a consult foreign country relatively less strenuous than here in order. Yeah, I think in a way correct, I suppose. I mean, because number of patients are less and the work regulations are much less stringent, for example, work hours. And in countries like Australia and Canada, the salaries are much higher and the quality of life, I think it is higher in that case and relatively less strenuous. But it all depends on the choices. It all depends on the choices. Yeah. Can a SR stay beyond a training period in the given country as a physician? Okay, yeah. Not in that way. Not in that way. Then it will be considered as a default. So that means if there is a stay beyond, then the bond has to be paid. Can someone start a postgraduate program while doing internship? Not with PGIM, but some of to start the PhDs and others. But during internship, I suppose it's going to be rather strenuous because internship period is going to be very hectic and not a time period where you can focus on or PhDs or MScs. It would be rather difficult. But during the RHO period, you may start. To start the PGIM, then it has to be 1 year post-intern. USLMIL exams, as far as I know, there are no scholarships for the expenditure. And yes, there is a lot of, you have to take classes and a lot of training involved. Okay? So it's not an easy pathway, migration to USA. But as far as I know, there are no scholarships. Is there a mandatory minimum period of government service if a person intend to migrate? No. It depends on the migrating country requirement, what kind of qualification they are expecting. What's the difference between RHO and SHO? RHOs are just a kind of a temporary arrangement after internship till you get the permanent position. Yeah, permanent post-intern position. SHOs can be any time after that. And some wards, they have SHOs. Yeah. All right. So, is there a gap years allowed in government sector? Okay, gap years means yes. I mean, at the moment, this option is still under discussion. What we call, say, circular migration, where you migrate and work in some other country for some year and come back without losing your seniority. That option is not there at the moment. But another option is taking leave. You can take no pay leave from the government, and then in that case also you don't need to rejoin. So these options are there, but for longer durations it is not still available. Short time duration, taking leave is available. I suppose a lot of questions, but yeah, a lot of areas that you need to clarify. Some areas still may not be very clear to you. Yeah. So try to follow the simple pathway that I have mentioned. It's very complex. I mean, there are endless possibilities. The most important thing is decide what you like. If an individual intend to settle in a country while engaging in foreign training, do they have to sit for the licensing exam? Yes. Yeah. Because foreign training is only for training. That recognition is only for training. If someone want to practice as a physician in a particular country, then you have to basically sit for the licensing exam in that particular country. If such person sits for licensing exam and passes, will he be recognized as a consultant? No. Licensing exam is to license to practice only. License to practice, not as a consultant. If someone has to be recognized as a consultant in that country, then after passing a licensing exam, then you have to go through that postgraduate pathway and become a consultant. So these are two different. Licensing exam is one, postgraduate exam is another one. Okay, yeah. What is the process of resigning as a doctor? If someone chooses to change the career pathway for some reason. Okay, say if someone want to leave soon after internship, then there is no need to resign. Basically, can join straight away because there is no service seniority and there is no, because internship is considered as a training period. So once recruited to the Ministry of Health and employed as a maybe during RHO period or SHO period, then at least 1 month notice has to be given. At least 1 month notice has to be given for recognition. Okay? Yeah. And so those are the another possibility is secondment. What you call secondment. For example, you join from Ministry of Health to the university, but without resigning. In that way, because even if you resign, then there's service breakage. Service breakage means the number of years in the Ministry of Health may not be considered for the university for the seniority. So that will affect the promotion and also things like permit, so on and so forth, those kind of privileges. So another option is a secondment. That's a longer pathway and you have to get the Public Service Commission approval, rather long procedure, but worthwhile because then your service break will not happen. The seniority will continue. That's what you call secondment. Secondment from one ministry to the other ministry. What's the best place to do specialist training? That varies with the, of course, that varies with the specialty. Traditionally for clinical medicine and surgery, most of Sri Lankan doctors, they were going to UK and they have the tradition, and a lot of UK hospital, they know that Sri Lankan graduates are very good and basically they are very competent. So they basically accept application from the Sri Lankan graduates. It depends on the set in the center. There are a lot of Australian. If you want to go for say the emergency medicine, there are a lot of places in Australia because they are very good in emergency medicine. The traditional subjects like clinical medicine and surgery, maybe UK or maybe Australia. Okay. Sometimes, nowadays, some doctors select countries like maybe Singapore and maybe Malaysia. Those countries also depending on the center of excellence. Yeah. So postgraduate, if you want to become a consultant in another country, yes, you have to go through that postgraduate pathway.
Yes, so I think we can conclude the Q&A session.
I think so. I think we have covered a lot of areas, a lot of interesting questions. Yeah. And but I suppose, there will be more questions to follow. Yeah. More questions also coming up. What do you recommend best choice for the country if one intends to become a neurosurgeon? That depends on the needs of the country also, not different. For example, say psychiatry, there's a lot of demand in Australia. Emergency medicine, general medicine, there's a lot of demand in Australia. So neurosurgery, again, it depends on the countries, no? Yeah, I can't come out with an answer straight away for that, and I don't have experience related to that. Maybe you can maybe ask that question from a neurosurgeon in the country, then that you might get a better answer. Yes. It depends the country, the center of excellence and the needs of the country. Okay, so yeah, so think simply. Again, the most important is do what you want to do. Okay, don't think about migration. Don't think about earning money. See what is the area that you can serve best. What is the area that you enjoy most. Okay, select according to those.
Yes. Uh, I think with those questions, we come to an end of our Q&A session. Thank you very much, sir. I think it was a very interesting and very informative session, Q&A session. So I would now like to invite President of the Students' Union of the Faculty of Medicine, Vishud Pasidu, to deliver the word of thanks. Thank you, Vishud. So, with that, we come to the conclusion of today's session, the second session of the Citizen Project. So, we hope to meet all of you with the next session of Citizen. Good night, everyone.